children's health and a startling reality. Tens of thousands of preschoolers in this country are on anti-psychotic medications, a number that's doubled in the last decade. The trend raises many questions, especially since most of these medications have not been tested on children and doctors have little idea what their effect may be on the developing brain. Tonight, we meet a family faced with a profoundly difficult choice. For this little boy, what you're seeing is not just a momentary tantrum, but the stuff of everyday life.
That hurt.
Day in and day out, Cole Evervold's parents, Jennifer and Chris, have had to cope with his thrashing, banging, and screaming. It's certainly not what they thought life would be like when they adopted him as a newborn 7 years ago.
I guess he really was fussy. He cried and needed to be held a lot, and he never slept. I thought it was, he's baby and maybe he's a little colicky.
But he wasn't just a little colicky. By 2 months, there were already problems at daycare.
The woman says he's high maintenance. And I thought, he's an infant, he's young. You know, what does high maintenance mean when it's a baby?
In part, it meant that by the time he was 2, Cole was on daycare number 4.
He broke a picture on the wall, pulled her curtains down, and just turned the whole room upside down. He just had an all-out rage.
This home video shows Cole in one of those rages, his room stripped down to keep him from hurting himself.
You made him a cell, essentially.
Yeah.
Jennifer and Chris weren't just worried about Cole hurting himself, they were terrified he had hurt another child.
And when he was hitting our friends' children, I started to worry. I think that might almost be worse for my heart, to have him injure another child or kill by accident.
Or not by accident. He's
or
angry.
Not.
He's angry.
He is. And that scares me more than anything.
His most frequent target, his little sister, Bryn.
Hands to yourself.
His parents say Cole actually tried to kill his sister with a metal shovel.
I'm sitting in the house and I heard the hit. He hit her over the head with a shovel.
Yeah.
And I walk out there, what are you doing? Oh, I'm trying to kill her.
Bring your damn butt, I'll kill you so hard.
But why? What was going on with Cole? There were some clues. Cole's birth father had bipolar disorder, and the couple was warned that Cole could inherit the disease.
When we adopted him, we thought giving him a loving family, giving him a good upbringing, it could maybe help that out a little bit.
But no amount of love seemed to be helping Cole. By the time he was 3.5, the family was in turmoil.
Hi, Cole.
Cole's pediatrician, Dr. Ernest Swihart, says Cole's behavior was getting worse.
The range of kids you've seen with the kinds of issues that Cole has, where is he on the spectrum? If 0 is a kid who's just a regular old kid and 10 is the worst you've seen, where's Cole?
Well, he's pretty up there. He's a 9.
He is.
Yeah.
Dr. Swihart began by diagnosing him with ADHD and a mood disorder. But there was more.
Cole, I think, because of his family history and because he really cycles, will probably end up as an adult with the diagnosis of bipolar disorder.
And Dr. Swihart had a treatment in mind, an extremely controversial treatment. When Cole was only 3.5 years old, Dr. Swihart prescribed a potent mix of psychiatric drugs for him, including Adderall to treat his ADHD and Seroquel to stabilize his mood.
Obviously, I said, heck no. My kid will never go on medicine.
I was scared too, because every medicine we give him, there's always a death warning on what could happen. It's scary, but we really didn't have the luxury of time. We have another child in the house. Even our friends' children, he took a croquet mallet to one of our friends' kids' heads.
It was a big decision for she and her husband to put a 3.5-year-old boy on medication.
That's right.
A big decision for you too, to recommend it?
Huge decision. Yeah, huge. Back in the old days, a kid like this would probably end up in an institution.
His condition's that acute.
Oh, yes.
But the meds didn't work. The rages continued. When Cole was 6.5, Dr. Swihart took what many consider a radical next step, prescribing lithium for Cole. the powerful antipsychotic used for adults with bipolar disease.
Behold, he gets better with lithium. He really, if he has the rages now, they're much more subdued.
Look at this picture, look at that.
That is awesome. Nevertheless, the use of such drugs in very young children is highly controversial. Psychiatrist Mark Olfson has studied the rate at which antipsychotic drugs are being prescribed for kids, a rate that's doubled for preschoolers in the last decade. Give me a sense of how many children and adolescents are taking these antipsychotic drugs.
I've seen estimates as low as 500,000 in the course of a year, but there are other estimates that suggest several million children.
Several million children.
That's right. That's part of the concern here, is that most of the time these medications are being prescribed to children. They're being prescribed for things where we really haven't studied them and they're not indicated.
Have most of these medications been tested in children?
Only a couple, but only in very small samples.
But the Evivols and Dr. Swihart say it's worth the risk.
Consider the alternative. What's going to happen to him? He's going to fail in school. He's going to fail in all kinds of human interactions. He's going to have a pretty miserable life.
It's time for medicine. Let's go.
But we wondered, was it really drugs that Cole needed?
To folks who are watching this, who have their own kids, and you say, give me that kid for a week, I'd straighten him out. You say.
Okay. Give it a try.
Right.
If you haven't walked in her shoes, you don't know. Nobody's going to make Cole normal. That's just not going to happen.
Even with all the medications, Cole, now age 7, can still be highly irritable and aggressive, especially in the morning.
No.
On this morning, Cole gets the idea to attack a still sleeping Bryn. Jennifer's not fast enough to stop him. So, what about 5-year-old Bryn? What of her childhood?
Do you feel afraid of him?
Yeah, kinda in the morning and the afternoon.
You do?
Yeah, because I think he'll hit and stuff, and I'm really right.
Yeah. So you just try to avoid him?
I just try to stay away and not ask him questions and stuff.
So do people who are watching you right now and say, how could you put your 3.5-year-old, your 4.5-year-old, your 5.5, now 7, on these drugs, you say?
For the first year, I couldn't tolerate it.
He had his heels ground in.
When you're giving your, at that time, what, 3.5-year-old, 4-year-old kid medicine, and you see the effects of it, I mean, it's haunting. I mean, when he eats his dinner and his eyes are rolling in his head.
How you feeling? Good? 2 thumbs up? Hmm? 2 thumbs up.
Does it taste good?
There you go. By dinner time, Cole's evening dose is beginning to work, and he can barely keep his eyes open. Some of the side effects, even for a child who may well need the medicine, are obvious. This is a hard question to ask you, but if you'd known then what you know now, would you have gone through with the adoption?
100%.
Yes. Yeah.
No question?
No question.
Even with all the heartache?
No.
He's still underneath the bipolar. He's the sweetest kid in the world.
He is, yeah.
So, I mean, I wouldn't trade him for the world.
It's funny, it's like a mask, you know. The bipolar puts the mask on him for a while, but then when it comes off, he's just his own sweet, loving little guy.
So, while you may want to strangle him occasionally.
Yeah.
Daily.
You love this little boy.
Yeah.
Yeah.